Hi, this is Nida. Welcome to my channel. Today's discussion is medical surgical nursing cardiology. Let's talk about normal electrical conduction system of heart. In normal electrical conduction system of heart, the SA node, that is known as what, primary pacemaker or natural pacemaker or physiological pacemaker of the heart, the electrical impulse starts from the SA node, then it travels to the AV node, then from AV node to the bundle of his, then to right and left bundle branches, then finally to the Purkinje fibers. This is the way the electrical impulse travel. This is a normal method of conduction of electrical impulse in the heart. If there is any problem in the formation or conduction of the electrical impulse within the heart, that leads to dysrhythmia or arrhythmia. Okay, let's see what is meant by arrhythmia. It refers to any change from the normal sequence of electrical impulse. The electrical impulse may happen too fast or too slow or erratically, causing the heart to beat too fast or slowly or erratically. When the heart does not pump properly, it cannot pump blood effectively. So that is about arrhythmia. The arrhythmia can be tachyarrhythmia or bradyarrhythmia. It can be sinus arrhythmia, then atrial arrhythmia, ventricular arrhythmia, junctional arrhythmia, etc. The different types of arrhythmia. Now we can see some of the important questions related to arrhythmia. Arrhythmias are caused due to. Options are abnormalities in the generation of the electrical impulse. Option B, abnormalities in the conduction of the electrical impulse. Option C, both. Option D, none. The correct answer is option C, both. It can be due to abnormalities in the generation and conduction of electrical impulse. Okay, we can see the next question. The nurse is monitoring a client who has received antidysrhythmic therapy for the treatment of premature ventricular contraction or PVC. The nurse would determine this therapy as being less than optimal if the client's PVCs continued to. The nurse would determine this therapy as being less than optimal. It means it is not effective if the PVC has continued to. That is the question. So you have to read the option. Options are occur in pairs, B, univocal in appearance, then be fewer than 6 per minute, then fall after the end of T wave. These are the options. What will be the answer? The correct answer is occur in pairs. The correct option is occur in pairs. PVC occur in pairs. We can discuss a few points about PVC. PVC are considered dangerous when they are frequent, that is more than 6 per minute. Then occur in pairs or couplets or multifocal or multiform or fall on the T wave. So these are the options. Okay, so that's why we selected what the option 1, that is what occur in pairs. That is the correct answer. So what is meant by PVC? It is premature ventricular complex, premature ventricular contraction. We can call it as PVC. It is relatively common event where the heartbeat is initiated by the Purkinje fibers in the ventricle rather than by the SA node. Actually, the SA node, it is the initiator of the normal heartbeat. Okay. And from SA node, electrical impulse has to start. SA node has a special ability that is known as what? Automaticity. But in this case, what happened? The heartbeat is initiated by the Purkinje fibers in the ventricle. So it is abnormal. That's why we can see what? The premature occurrence of QRS complex, which is wide and distorted in shape. That is the main character of the PVC. Premature ventricular complex. That is characterized by the occurrence of QRS complex, wide and distorted in shape. And it is of different types, no? Bigeminy, trigeminy, quadrigeminy. Paired PVCs like couplet, triplet and quadruplet. These are the different types of premature ventricular complexes. Okay, you can see one PVCs. In this PVC you can see wide and distorted QRS complex. You have to identify the normal wave. Okay. Then you have to see any abnormalities in this ECG. You can see a wide and distorted QRS complex. And this QRS complex that occur earlier than the normal next expected QRS. So before the next expected normal QRS complex, there is a PVC. So that is premature ventricular contraction or premature ventricular complexes, and that is wider than the QRS and it's bizarre shape. And we cannot identify where is the P wave. There is no preceding P wave. Okay, in the PVCs there is no preceding P wave, and we can see a compensatory pause after the PVC. So this is the character you have to keep in mind. What? The wider bizarre QRS complex, and that occur earlier than the next expected normal QRS, and there is a compensatory pause after this premature PVC, premature ventricular contraction. Okay. Okay, the different types of PVCs are bigemini, trigemini, quadrigemini, and couplet and triplet. What about the bigemini? Bigemini means PVCs that occur every other beat. Trigemini means PVCs occur every third beat. Quadrigemini, PVCs occur at every fourth beat. 2 PVC in a row, that is couplet. 3 PVC in a row, that is triplet. Okay, we can see what? Ventricular bigemini, you can see the PVC here. Yes. Every next beat. Ventricular trigemini, every third beat is the PVC. You can see the PVC here. Then what about the couplet? That is 2 PVC in a row. What about triplet? 3 PVC in a row. These are the different types of PVC. And you can see the PVC, no? This is the PVC. Yes, in ECG, and in between you can see normal beat also. And this is what ventricular tachycardia and ventricular fibrillation that we can discuss later. Yes. What is the next question? In ventricular tachycardia, extrasystole appears in. Options are option A P wave, B QRS complex, C T wave, and D R wave. What is the answer? That is the option B QRS complex. We have to see the abnormality in QRS complex. We can discuss few points about ventricular tachycardia or VT. It is a repetitive firing of irritable ventricular ectopic focus at a rate of 140 to 250 beats per minute or more and can lead to cardiac arrest. Rapid occurrence of premature ventricular contraction with no normal beat in between. That is one of the important character of VT, and in this case P wave may be absent. PR interval cannot be determined. QRS, it is very broad and bizarre. That is the main character. QRS is broad and bizarre. T wave cannot be determined and QT cannot be determined. You have to keep in mind about how we will identify the ventricular tachycardia. You have to see the rhythm. Rhythm is usually regular. And what about the QRS? QRS is abnormal in shape, or we can call it as bizarre one. And what about the P wave? Very difficult to detect. Okay, these are the points you have to keep in mind. Understood? Ventricular tachycardia or VT, the rhythm, usually regular. QRS, it is abnormal or bizarre. P wave, very difficult to detect. Okay, so we can see a VT. You have to look at the rhythm, usually regular. And you have to look at the QRS complex. It is broad one and it is abnormal one. So that is VT. Next question. Which ECG finding is most likely to be seen at the time of cardiac arrest? Options are option A atrial flutter, option B atrial fibrillation, option C ventricular tachycardia, option D ventricular fibrillation. What is the answer? Option D ventricular fibrillation. What is ventricular fibrillation? Ventricular fibrillation occurs as a result of multiple weak ectopic foci in the ventricle, characterized by electrical impulses initiated by multiple ventricular sites, and impulses are not transmitted through normal conduction pathway. You understand what? the electrical impulse has to start from SA node. In this case, what happened? The electrical impulse initiated by multiple ventricular site and impulse are not transmitted through normal conduction pathway. The ventricle cure and it is fatal if not successfully terminated within 3 to 5 minutes. The rhythm that is extremely irregular and rate is 300 to 600 per minute or indeterminate. You keep in mind few points about VF. In VF, the rate is very high or indeterminate and the rhythm is extremely irregular without a specific pattern. There is no specific pattern for ventricular rhythm in case of VF. Then about the QRS shape, it is irregular. We can see undulating waves without recognizable QRS complex. You can see the VF, it is characterized by what? Irregular rhythm, extremely irregular rhythm without a specific pattern, and about the QRS, it is irregular and we can see undulating waves without recognizable QRS. That is a peculiar character of VF. I think you got some idea about VF and VT. Okay. We can go to the next one. Question number 18. All are true about WPW syndrome except Wolff-Parkinson-White syndrome. That is WPW syndrome. All are true about WPW syndrome except that is not seen in WPW syndrome. That we have to find out from the options. Options are congenital heart anomaly. Option B, more common in female. Option C, delta wave in ECG. Then option D, short PR interval. What is the answer? That is except, that is the question. So the correct answer is what? More common in female. Other options are correct regarding WPW syndrome. We can discuss what is WPW syndrome. One more question, then we can discuss. Radio frequency ablation is done for atrial tachycardia, ventricular tachycardia, paroxysmal supraventricular tachycardia, WPW syndrome. What is the answer? The answer is WPW syndrome. So what is WPW syndrome? It is Wolff-Parkinson's-White syndrome. In this case, there is an accessory conduction pathway. Additional conduction pathway is present between artery and ventricle. We all know the conduction pathway. SA node, AV node, bundle branches, Purkinje system. That is a way of conduction. In this special case, what happened? Accessory conduction pathway is present between artery and ventricle. Electrical impulse are rapidly conducted to the ventricle. So this rapid impulse creates slurring of the initial portion of the QRS called delta wave. There is a special character of the Wolff-Parkinson-White syndrome. And the rhythm is regular unless atrial fibrillation present. That is also you have to note. Then the peculiar features, we can see QRS complex broad, slurred upstroke to the QRS complex, ST and T wave, discordant changes. This all changes we can note. We can see one wave. This is Wolff-Parkinson-White syndrome. Look at the QRS complex. There is a slurring of the QRS complex. It is due to additional pathway or accessory pathway between the atria and ventricle. So this is known as what? Delta wave. Okay. Okay, this is brief about my class. If it is useful for you, please like, share and subscribe my channel. Thank you.